Let's now talk about other tumors in the ENT area. A 52-year-old man complains of hearing loss. When tested, he is found to have unilateral sensory hearing loss, one side only. He does not engage in any activity such as sport shooting that would subject that ear to noise that spares the other side. Let's talk about this a bit. If a patient says, I cannot hear out of this one side, and when you examine the patient, it is conductive loss. It's probably a plug of cerumen or something wrong in the middle ear. But when you realize that it is sensory loss, you expect it to be bilateral. Because if you develop sensory loss because you work in a very noisy factory, because you fly an airplane that's very noisy, both ears are subjected to the same insult. And only something pretty weird, like where we already touched upon here, if the hobby of the patient is shooting, and the patient puts a weapon here, and this ear gets the bang and the other one not, except for something like that, if you have unilateral sensory hearing loss, you have a tumor affecting the eighth nerve. And that's the significance of this vignette. And the best way to look for tumors inside the head is MRI. So you want to do an MRI looking for that tumor. Here is another example where you will be doing the same. A 56-year-old man develops slow progressive paralysis of the facial nerve on one side. It took several weeks for the full-blown paralysis to become obvious. It has been present now for 3 months. It affects both the forehead and the lower face. This suggests a neoplastic process. If a vignette had said a man went to bed as handsome as ever, and the next morning he wakes up with half the size, half the face paralyzed, well, that is Bell's palsy, not malignant. But this gradual loss of the function of both branches of the nerve, probably a neoplastic process affecting the seventh nerve. Do the MRI. This would be a gadolinium enhanced MRI, but do the MRI. Now, vignette number 14, a 45-year-old man presents with a 2 cm fear mass in front of the left ear, which has been present for 4 months. The mass is deep to the skin and it is painless. The patient has normal function of the facial nerve. Any tumor in front of the ear, behind the ear, around the angle of the mandible is a parotid tumor until proven otherwise. And the most common parotid tumor, the one this man has, is a pleomorphic adenoma. They can grow to pretty significant size. They can be as big as a golf ball or a hen's egg, but they typically, even when they are that big, have no pain and they do not interfere with the function of the facial nerve. We like to remove them though, because a pleomorphic adenoma has the potential for malignant transformation. And there is only one opportunity to do it right, and that's with an expert doing the first operation. And so if you're confronted with this vignette on the exam, you may take pictures of that if you want. You could do a CAT scan, or you could do an MRI, or you could do an FNA, but please don't pick an answer that says make a little cut and take a piece of it. Because if you do that, you're going to mess up the next operation. You might injure the facial nerve when you do that. You might transect the salivary duct and the patient ends up with a fistula. So the rule is parotid masses, the first time around, it's got to be done by an expert in the form of a formal superficial or superficial and deep lobe parotidectomy, sparing and preserving the facial nerve. The next vignette is a variation of that one. A 65-year-old man presents with a 4 cm hard mass in front of the left ear, which has been present for 6 months. The mass is deep to the skin, it is fixed, he has constant pain in the area, and for the past 2 months has had gradual progression of left facial nerve paralysis. He has rock hard lymph nodes in the left neck. This is a parotid cancer. There are at least 5 or 6 different types of parotid cancer. But I don't think you need to go into those. This is a parotid cancer. You could do an FNA, but no more than that. Let the experts do the management. In this case, in fact, the experts would do a total parotidectomy, sacrificing the facial nerve, which is involved in the tumor, and a radical neck dissection. And then take one of the sensory nerves out of the brachial plexus and use it as a graft to reconstruct the facial nerve.